So next, we're going to talk about Ondansetron and the other drugs from the same group, such as Dolasetron, Granisetron, and also Palonosetron. So these are all drugs that come from the group called the serotonin 3 receptor antagonist. So they are all serotonin 3, 5-HT3 antagonists or blockers. So these drugs, what they do is they block the serotonin receptor, or you could say receptors or receptors in the chemoreceptor trigger zone, and also in the gut. So in the intestine and also in the chemoreceptor trigger zone in the brain. So these drugs, namely, we have Ondansetron, we have Palonosetron, and we have Dolasetron, and also Granisetron. So we have DGOP, Dolasetron, Granisetron, Ondansetron, Palonosetron. But I think this is the most commonly used drug in the group, as far as I know. Okay, so we have these groups, these drugs, in this particular group called the serotonin 3 antagonist. So these drugs, all of these 4 drugs, one, or if you want 2, 3, and 4. Okay, these 4 drugs, they block the receptor. They block the receptor here. Okay, so all these 4 drugs, they block the serotonin 3 receptor at the chemoreceptor trigger zone, and also in the gut. So the drug blocks these receptors. So that's how it works, okay, by blocking the receptor in the chemoreceptor trigger zone and also in the gut. So what are the indications for giving Ondansetron and other serotonin receptor antagonists? So it's particularly effective for vomiting that is caused by chemotherapy, and also radiotherapy. So in patients with cancer, they usually will receive chemotherapy or radiotherapy or both, and these are used to treat malignancy or cancer. And they are also given for post-op vomiting that is resistant to other agents. So this, in theory, these are the two reasons why patients should be given ondansetron. But of course, in practice, people use it for a much wider much wider reasons. Okay, they use it for many reasons. Even some people will just give ondansetron for any kind of vomiting. Okay, so these are just these are the main indications. Okay, meaning chemotherapy-induced vomiting, radiotherapy-induced vomiting, and also post-operative or post-surgery vomiting that is resistant to other agents. Okay. So before that, we should talk a little bit about the preparations and dose. So basically for ondansetron, we have tablets, 4 milligram, and then we have injection, 2 milligrams per meal. And then we have the brand name called Zofran, which is in a syrup form. And we also have suppositories, okay? Suppositories. So this one you put it up the anus, okay, or the rectum. So suppositories given through the rectum. So with regards to the injection, you can give the injection intramuscularly and also intravenously. So, for example, to prevent post-operative nausea and vomiting, okay, so to prevent people vomiting and having nausea after a surgery, so we can give, for example, 16 milligrams of ondansetron 1 hour before giving anesthesia. And also, we can give another 4 milligram during the induction of anesthesia, okay, when the patient is on table, okay, on table ready for surgery. So what are the side effects of taking ondansetron? So they can have headache, so which is a CNS adverse effect, and then they have GI adverse effects such as constipation, and also we have other miscellaneous reactions such as the hypersensitivity reactions. Or if you want, you can put this under immunological adverse effects or unwanted effects. And for IV ondansetron, it might cause seizures, chest pain, arrhythmias, hypotension, and also bradycardia. So all of this, all these four are cardiovascular adverse effects. Okay, so this is CNS. So seizures or fits or convulsions, and then we have chest pain, low blood pressure, low heart rate, and also abnormal rhythm of the heart, arrhythmias. So these are the adverse effects that are associated with taking intravenous serotonin 3 blockers, okay, such as ondansetron, contraindications, dolasetron, halonosetron, okay. So dolasetron, contraindications, ondansetron, halonosetron. So these are the main 4 serotonin 3 antagonists used for the treatment of nausea and vomiting. So let's go talk a little bit on the cautions or contraindications for giving ondansetron. So mainly you have to be cautious with regards to prolongation of the QT interval, okay, on the ECG. So we have the PQRST. So the QT interval, you have to beware of the prolongation, okay, of the QT interval. Prolongation of this, okay, QT interval. So you should be cautious when giving patients with QT issues or potentially QT issues, but ondansetron. And also you have to be cautious in patients with cardiac conduction disorders. Okay. So that's all for this short mini lecture on ondansetron. So we'll see you people in the next presentation.